All right, everyone, I have 1 o'clock, but I'm going to give it just another minute because we still have some people joining us. So we'll get started in just one more minute. All right, everybody, it seems like the numbers have slowed down of those folks who are joining us, so I think we're safe to get started. I'm going to go ahead and go past the housekeeping issues. This is our third webinar for the electronic visits verification system in the month of September. Thank you for joining us. It is and continues to be very important to have your input as we move forward in the process of being compliant with the federal mandate for the electronic visit verification. As always, we start with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to talk about today? As always, we are going to start with our EVV member updates. We're going to give you a project update, where we currently are. We're going to go over training resources. We're going to do some revised common issues or questions, because we've had a few changes in what we're seeing out there as common issues and questions associated with EVV. We're going to talk about the next town hall. We're going to do a third-party EVV vendor update, and then we'll go through and do some questions and answers as time permits. So let's start off with our member updates. As always, we start with our self-directed updates as requested by our self-directed members. So I want to start with, again, that if you are a self-directed member or representative currently supported by public partnership, and there were about 105 total members out there that were using public partnership, and you're receiving EVV applicable services, public partnership is no longer going to be one of our fiscal intermediaries in the state of Georgia. So you need to be working with your support coordination agency to switch to either Acumen or Continuum in order to receive future fiscal intermediary services associated with self-direction or participant direction. Both of the existing FIs, Acumen and Continuum, have their own way of delivering EVV. So it's really important that you get trained and up to speed with EVV in advance of November 1st, 2021, to ensure that you have no disruption in your staff payment and can continue to provide the services that you need as a self-directed member. I want to provide some training resources also, and these are available online on our EVV website, and they are available in all the past presentations as well. If you still have questions for public partnership, then you can email Chantil Talley at Public Partnership. She will respond to you, and then these are training resources and contacts for both Acumen and Continuum if they are your new chosen agency, or if you're a self-directed or participant-directed member out there and you're having trouble getting response. I would encourage you to use these contact information. I know when I forward to any one of these folks, they are very responsive in their response to members as they are reached out to. Also, another important point for members and for the self-directed or participant-directed population is Georgia Lifeline. So for Medicaid members who need a smartphone, We do have a federal program that is working with the Department of Community Health to provide phones completely free of charge. The phones cost nothing for Medicaid members. Not only do they cost nothing for Medicaid members, they have unlimited text and unlimited calling. This is so that you can make appointments to your doctor or receive updates about your health or future appointments. So these phones are completely free. They have unlimited talk and unlimited text. They absolutely positively are new phones, and they can support the EVV application. Now, the phones don't have unlimited Wi-Fi data, but there is some free data for you to be able to use. But the EVV application that we use in the state of Georgia does not count towards your data allocation that is free. So EVV minutes are completely off the board when it comes to using a Georgia Lifeline phone. So even if a member were to run out of all their other minutes, the EVV application and Mobile Caregiver Plus would continue to work. So this is a really great benefit. We originally had talked about doing fixed devices. If you're a provider out there and your aide has no phone and there is no IVR landline to be used inside the house, then we would strongly encourage the member to apply for a Georgia Lifeline phone so that they could just keep it in the house, and as the aides come in, they would access the mobile application, put in their unique username and their unique password, and be able to clock in or clock out. Even if they were meeting the member in the community, the member could take this phone with them and use it as their connection point for Netsmart's EVV system. I'm trying to use the right name, and it is Netsmart. Okay, I'm going to stop here just so that if the members, you're welcome to join us. If you have members on, we're going to go through some other important information. But if you're a self-directed member or a participant-directed member, this is going to focus a lot more at this point on traditional providers. So you may see a switch. I know early on in presentations, we weren't doing a targeted introduction just to self-directed and participant-directed. And I got a lot of comments that we needed to reorganize the meeting to be more responsive to you specifically. And so I just want to make sure that there's this delineation point now where you're welcome to continue to listen, of course, and these presentations will be available online on our website, along with this recording, the whole PowerPoint presentation. But let's go forward and talk about our project updates. So we sent out an email yesterday, and the big point is that we are making a date change to the mandatory required edit to the Georgia Management Information System, or the Claims Billing System known as GAMIS. We had said that mandatory claims edit for all EVV-related claims would go into effect October 1st, 2021, but we have moved that forward to November 1st, 2021. So we've moved forward just by 1 month, and that's to give some time for some outstanding issues to be corrected, and we'll talk about that in just a minute. But you do need to make sure that you have submitted at least one successful claim by ID into TELUS, or you have an active ticket open in the EVV system to ensure that you do not go on pre-payment review. You are required at this point to have submitted a claim by ID, and you are required to this point to have registered your ID. If you have not, you will be placed on prepayment review and you will not be able to claim. It's 2 simple, easy steps for the registration and to make sure you have one claim in. Now, if there is some outstanding issue by where you cannot claim for a member and you have a ticket or all your members, then we will certainly take that into account. So why did we move forward for 1 month? That's because we have some really big changes that are about to go in based on our provider feedback and use of the system. And we wanted to make sure that those were addressed by the end of this month, and we gave you an entire month to use the system before making the system mandatory. The biggest one of those is specific to the Now and Comp program. The Now and Comp program has a very unique, it's really unique in the entire United States, way of loading prior authorizations. So there are multiple modifier combinations for T2025, which is community living services, depending on all kinds of different factors. There's multiple different kinds of community living supports. What's unique in Georgia, very unique, is that we basically load all the units for whatever modifier combination the provider needs to use. So we don't prescribe, you get 10 units of this combination, 10 units of this combination, and 10 units of this combination. We say, here's 30 units, and you can use it any way you want. Well, this unique way of doing business and receiving PAs is not something that Netsmart had seen in other states. And so we've had to make some configuration changes to make sure that we load all those units into the system. That is expected to go into place at the end of this month. Now we're just going to load the max number of units for use on any line. So just as it is now, it will be up to you as a provider to ensure that you have not overgone the PA limit. And of course, GAMUS will always, cap out at what the PA says the multiple limits are in the system, regardless of the code modifications. So if you bill over the allotted amount, GAMUS is going to catch that and say, I'm sorry, you're out of PA units. So that absolutely has not changed. Also, we've been talking for a while about rounding rules. We are adopting the Medicare rounding rules. And that is something that we are going to have in place and have communication out by the end of the month. New rate adjustments. Some of y'all took this to mean that we had updated all the rates for home and community-based services. That is not correct. There was one outstanding rate adjustment for Now and Comp, and only in Now and Comp, associated with an Appendix K for the public health emergency, where the Now and Comp providers have received a rate increase. That rate increase is not properly reflecting in the Netsmart EVV system. You can adjust the rate manually, but I have heard from many providers that this is an administrative burden on them, and they have requested that we go in and fix it. So we are in the process of doing that. We hope to have that done well in advance of the mandatory claims edit, so that you do not have to go in and make that one-time change to the system, to the rates. So again, these are our outstanding critical issues. We will have these issues updated here by the end of the month, and it should give you an additional 4 weeks to work in October before making all CLS and PLS claiming mandatory through the EVV system. If you again, I've already gone over this. If you have not registered and you have not submitted one claim per ID, that is something you need to do immediately. Like, you need to do it here in the next couple of days, or you need to have an open ticket for why the claim isn't processing. There are really no excuses for not having your ID registered. We have not found a valid reason why an ID can't be registered at this point. So if you have an ID out there that hasn't been registered, you need to call the call center if you can't get it registered immediately. But if you cannot get any claim processed via one of your IDs, you really need to make sure that you have an open ticket so you don't be placed on, so you are not placed with that ID on prepayment review. So we wanted to give you some key statistics because sometimes there's this narrative that I hear that nothing is working in EVV, and that it's, it's terrible, it's awful. I get this. So 80% of our providers have registered. We're not, that number is something we're looking at, because as you may or may not have known, about a week ago, we did a data cleanup. Many of you all were getting information that was not relevant to EVV in your feeds. You were getting old data. You were getting data for things like structured family caregiving and community access group and community access individual, other IDs that were not associated with EVV. We've gone back and cleaned that up. So that has really messed with our percentages somewhat, because it's given us a different number of providers. But currently we think we have about 80% of our providers registered. Now you may be saying, well, 80% seems low. You mean 20% of the providers out there haven't registered? You would be surprised. What we're seeing most of the time is we have lots of providers that have gone through the process to become Medicaid providers, but they have no members. I know I hear a lot about the business and how tough the business is, but we have multiple providers out there that are ready to serve our members, but they have no members. And because of that, they haven't registered. We also have a lot of providers that heavily do other business. Maybe they do alternate living services or community residential alternative. So they're more in the residential space, and they have a personal support ID, or they have a community living support ID, but they don't really have any members in it, so they don't really register. So there's an awful lot of those IDs that are out there that are sitting out there. They've been open, but they don't have any members. Now we have over 1,000 Medicaid IDs, provider IDs, that have completed a visit using EVV at this point. And we have over 850 IDs that have submitted at least one claim through the state solution. So that's a heck of a lot of providers that are fully compliant with where we're asking you to be in advance of the November 1st deadline. So that's great. It's over 850 who are able to get a claim submitted. And just another interesting point, we have one provider that has successfully submitted over 18,000 claims through the state EVV solution. So we have a provider out there who is basically doing all of their business at this point, or a vast majority of their business, through EVV and have become fully compliant, and they are a very large provider. So I'd like to give a brief update about case management. We have delayed that case management functionality, which is that look-in for case managers. That's a view-only view for just their members, so they can see how services is going, receive messages from the providers or the members. So that is a real good enhancement for quality that we've been working on. It was originally going to be available in 9/16. We're hoping that the release date for that, we've just got a couple of tweaks and some more testing to do, will be closer to the end of the month or the very beginning of October. We don't anticipate it being much past that time. We will, of course, put out training guides, checklists, and all the functionality released to case management. We're going to do all our normal communication and be able to have that information out to you. Let's talk about training for a minute. I know I've gone over this if you've been in other meetings, but I continue to get a lot of questions that are very answerable through information that is already available on our website or through trainings. So we have multiple ways that you receive training for EVV. And it's really important to know that the training is really based on how you're planning on delivering EVV. If you're an administrator and you're using the Netsmart EVV system, you need to make sure that you have done the following 3 training webinars: Administrative Console, Mobile Application, and the Claims Console. Your caregivers or aides that are out there performing the personal support or community living support services need to register for and complete the mobile application training. That's all they need to know. They just need to know how the mobile app works. They don't need to know how the administrative console works or how to submit claims, but they certainly need to know how the app works, and you're going to want to know how that works too. If you're using a third party, one of our many third parties that we now have available for you to use that integrates with the Netsmart EVV system, then you should continue to register for the administrative training and complete you should register as an administrator and complete the claims console training. And your aides don't need to do the Netsmart training on the mobile application because they're going to be using the mobile application of your third-party vendor. You just need to make sure you know the claims console training so you will know how to release those claims and check and make sure that your claims are right. Please check with your third-party administrator if you haven't already and you're not fully trained on the use of the system. For the TELUS system, you can go to this website at any time, and all those trainings that I just talked about, the 3 important ones if you're an administrator, are available for you right here, admin, claims, and mobile. And then there's extra topics as well. There's a weekly live webinar training registration, and there's also pre-recorded webinars that you can look at your convenience. If you also go to the training website and that Q&A session, there is a weekly Netsmart EVV Q&A session that literally allows you to ask whatever questions you want to. If you go, hey, I still have questions about how to do scheduling with a differential schedule. My worker works 2 days this day and 3 days this day, and they're different times. That's what the Q&A session is for. You can get one-on-one answers for your questions in a live setting. Additionally, once you register for the Netsmart EVV solution, you will have access to user guides and short refresher videos. If you go to your menu on your drop down on the left as an administrator from your dashboard, there is a training queue. All of these trainings could be printed out so employees could have them or downloaded to any device for you to use for reference. And there are, let me go back to that slide real quickly. There are a lot of short videos. They're everything from how to change your password to how to submit claims. And they are very short in nature. They're very engaging, easy to watch, even for somebody like me who has a little bit of an attention problem. They are super easy to get the information you need. Okay, let's talk about some common issues and questions. I want to again go over retroactive billing because I'm still getting quite a few questions on the retroactive billing. So if a Medicaid member is out there, and this is a question I'm getting a lot, I have a member out there, they're active, I'm billing for them, but there's been a delay in their reauthorization, and so I don't have a current PA. Okay, since that's a member that you know and you've been working for, you can go ahead and continue to schedule visits for the member. The member will continue to be in your system. It's just that the system will be, the EVV claim will be unmatched until the PA comes in. Once the PA gets into GAMUS, it should get into the EVV system within about 3 days. And then that claim will turn from unmatched to matched and you can submit it. That's not different than what happens now, right? Because I get some people who are telling me, well, now I can't bill. Well, you couldn't have billed before. If you had a member and their PA expired, we didn't continue to process claims through GAMUS either. And in this scenario, you can still continue to do the EVV work. It's just we'll need that PA to come through to the Netsmart solution before it goes through and is paid. If the individual is not known to the agency, this is the first time they've ever been eligible, you're going to need to continue to do that work on paper until which time the member gets a PA and the member and the PA moves over to the Netsmart system. Then you can use the administrative console to go in and put in all of the retroactive visits. And we will know those are retroactive visits and that they are okay and totally above board with EVV. Another very, very, very important question that we are getting a lot of questions and concerns about are claim submission deadline. So EVV sends claims to GAMUS nightly at midnight. The GAMUS cutoff time for claims processing to receive your money at the end of the week is Friday at noon. But the EVV, and that has not changed, but the Netsmart EVV deadline is Thursday at midnight. So if you want to get paid for your members up till Thursday night, you need to submit your claims to EVV by Thursday at midnight. The Friday claims will have to go on next week's RA. So really, we took Friday between midnight and noon, and those got put on next week's RA. I don't think I really understood until we started EVV how many of our providers were furiously billing between 9 a.m. in the morning and noon on Friday to make sure that the payments went in on this week's RA. And we've gotten a lot of questions around, hey, I put in these people at 10 o'clock on Friday and I didn't get paid for them. And we've had to go back to the RA and said, yes, you did get paid for them. You just didn't get paid for them on Saturday. You got paid for them on a week from Saturday. So make sure you get all those Monday to Thursday claims in by midnight on Thursday night. So if you are missing members at this point, we need to know about it and you need to call the call center. Now, of course, if the members aren't on GAMUS, they're not going to be in EVV. But if they are in GAMUS and they do have an active PA for service on GAMUS, you need to call the call center because we have put in several fixes into the system and we're not getting a lot of missing members anymore. We're also getting a lot of questions about family caregivers and can you continue to use family caregivers? That's not really an EVV question, that's a DCH question, but we're getting it so often that we want to go ahead and address it as part of EVV, which is there has been no change to the Appendix K provisions that allow during the public health emergency for you to continue to hire family caregivers. Again, that is part of the public health emergency and the Appendix K, and we would give you plenty of notice before that would change at the end of the public health emergency. Third-party vendor integration. So we're quickly moving through the integration progress, and we have a lot of folks that are fully compliant third-party vendors. But you need to be working with your vendor to make sure that they are able to submit a claim or they have an open ticket why they cannot submit a claim. Nothing is different about being a third-party provider than being a traditional provider that is using Netsmart. All the same deadlines apply. The November 1st deadlines, the registration deadlines, and the fact that you have to submit at least one claim all still apply. So something that is new that's come up from 3 or 4 providers here in the last few days is a duplicate claims editing issue. So I'm gonna talk through what's happening. What's happening is I am provider B, and there's another provider out there that's provider A, and I have Brian as my employee who's an A. I go to submit my claim for Brian. He's scheduled and completed a visit. And I go to submit my claim and it's giving me an overlapping error. And the overlapping error is with another agency and another member. It's not an overlapping error where Brian, my employee, is working for 2 people in a shared situation under the comp or now waiver. We are aware of that issue and we're working on it. This is a different issue. This is that Brian has overlapping dates with provider A and provider B for 2 totally different people. Now, what's happening in this scenario may be something just that is a training issue. Maybe Brian was working for provider A and he forgot to clock out. And so then he went in and scheduled and clocked in and clocked out for provider B with the other Medicaid member. And the system says, wait a minute, you couldn't have been in provider A's house and provider B's house at the same time serving 2 different people. They're not even with the same agency. They're completely different agencies and completely different members. How were you able to be in 2 locations at once? We're getting a lot of this. So I want to encourage you not to go in and do administrative just billing off of a schedule. There is a lot of that has occurred, and we know there's a lot of it that's occurred historically. And I'll tell you how we know it's occurred. You would be surprised at the number of monthly edit claims we get for providers that bill for members who are in the hospital. and have been in the hospital for some time, and the aid is not working in the hospital. But the agency is still billing because the agency doesn't know that the aid isn't going to the house to provide services to the member. That's very common. The same thing is happening here. This member cannot be working in two places at the same time with two different members for two different agencies. That's just impossible. It's either an error in forgetting to do something administratively like clock out, or it's fraud. And we need to know which it is, right? This is the whole reason we have these systems, is to catch issues like this. It's the whole reason it's a federal mandate. And it's good to know that it's working. So if you do have those issues and you're unable to get them paid, you'll need to let us know. You'll need to send in the examples to the EVV mailbox. So, because you won't know who the other provider is, and we'll need to do investigation on our end with our staff to ensure what's going on and making sure that the claims are corrected and right. So please send us in who the member is, what is the ICN number for that member, so that we can, or any of the claims information for that member. If you don't have an ICN and you just have visit dates, give us that information, because we're going to have to, on the back end, contact the other provider and get what the real story is around the claiming. So this is just, I'm not going to go over this, but it's a graphic representation of how providers using a third party works. There is an extra step where the provider releases the information to make sure that it gets paid through the GAMA system. But several providers asked us for kind of a visual representation of how the entire system works for third parties. So we wanted to go ahead and put that in for you to see here in case you had any questions. If you need support, I strongly encourage you to call the call center. Excuse me, this is the call center's number, 833-701-0012. This is also their email address and a website for chat. Again, this information is on our website. Many of you guys write me directly, either to my email mailbox or to the EVV mailbox, and that's fine. But a lot of times my first step, if I don't see that you have already contacted the call center, is just to contact the call center. Because I do more than just EVV. I actually do everything from prenatal to hospice. So I'm not going to be the one to be your individual trainer on how to use EVV. That's why we have a contractor and a call center to walk you through and provide you the technical support that you need. Upcoming town halls. We will be doing October town halls in just next week, I guess. Is that next week? So yeah, next week from 1 to 2 and 6 to 7, we're going to really pare down those to just Q&A and make them as much as possible about open Q&A. They will be a lot shorter than this one because we're going to just try and make it an open session to hear what exactly you guys need out there in the field. Okay, we want to do alternate EVV and give you an update on that, because I was on a call just last week or it may have been this week, it was last week, where a provider said, hey, I don't know where my vendor is in the process. And last time I looked, there was only one EVV provider who was completely compliant. Well, that's, as you can see by this slide, we've been lucky enough to get a lot of EVV providers up and using. So all these folks are either fully integrated or well within the piloting point. And we are very, very confident that by October 1st, 2021, these folks are all good to go. And there are quite a few of them. I think it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So we're talking 30 different EVV options for providers. That is as much as I know from talking to any state to giving our providers options. It's quite a feat that we've been able to do. So these providers that you see on this page are still in process of integrating, but we don't think they're going to be ready by October 1st. They've still got some more piloting to do and some passing of data back and forth. So that is very, very important that you know that. We cannot guarantee that these providers will be ready by October 1st and that you will be fully trained in using the system by the November 1st deadline. And please remember, you still have to have a claim submitted across for your ID, or you will be subject to prepayment review. If your folks are on this list, they are folks who have either said, hey, we don't have any clients in the state of Georgia, so we're not interested in complying, or hey, we're a vendor in the state of Georgia, but we're not going to integrate with the Netsmart system. So if you are using any of these folks, you need to either transition to the Netsmart solution, transition to one of those 30 folks that are good to go. And those 30 folks do include the Netsmart system, which is completely free of charge for you to use. You don't have to pay to use the Netsmart system. Okay, I'm going to stop here, but I'm going to leave up the call center information for you to have in order to use for any sort of ongoing questions and answers you may have. So let's see what is out there in the Q&A. I don't have anything in the Q&A, but let me check the chat because I'm showing stuff in the chat. Okay, there is definitely stuff in the chat. There's a hi, hello. In GAMUS, we find out immediately if a claim is paid or denied. However, it takes a very long time to find through TELUS, which presents a great hardship. Will this continue to be the case? I believe the case is overnight. You should have a response file. So you should be able to look in GAMUS the next day because we send the claims overnightly, and GAMUS should be able to tell you if the claims is paid or not. Now, there is another day where the response file comes back. So there will be a 2-day delay into EVV, but you can check the next morning in GAMUS and you should be able to find it. We will, of course, take this suggestion back and see if there is any updates that we can do to make the system work even better. You have several provider IDs that I don't currently have any clients pending for PSS. No, if you don't have any clients on your IDs, there's no way for us to penalize you, right? Because you're not billing anything. All you need to do is make sure that you let us know when you do get some clients. Just go to the EVV mailbox and we'll make sure that there's no barriers to you going ahead and scheduling and getting that member on board for claims processing. Is the November 1st requirement for the date of claims being entered or the date that claims are being processed? Any dates of service on or after November 1st will have to be done through the EVV system. So if it's before a date of service before November 1st, they can be continued to be billed to GAMUS, but any date of service on or after November 1st will have to go through the EVV system. Is there an alternate contact for AT&T Lifeline? The information received didn't yield any results. Even contacted AT&T and they could not assist. We found an application online and helped to fax to the number, provided the application, and it failed. Yes, we do have alternate contacts and we can put that information out on our website. I don't have it right now, but we'll reach back to them and give out alternate lifelines. It's not AT&T Lifeline. We don't have any relationship with AT&T. This is GA Lifeline. They're different. They are not AT&T affiliated. So we can get the information in this website is the one that is valid, but we can give information that is appropriate for that. Is EVV up and running for skilled nursing? It's for personal support services in GAP, but it's not applicable to skilled nursing. There's another question about nursing. And if you have questions still about what codes are applicable to EVV, you can go onto the EVV website. All of the applicable codes are listed on the EVV website, front page. It'll give you every single code and every single modifier that it is applicable to. If it is not on that page, EVV is not applicable. We have CCSP support provider access, but no clients. Registering your ID in advance is not a problem. That is a great thing. So thank you for doing that. Just let us know when you have a member and we'll make sure that there are no issues with you billing. We are aware of the T2025 shared resource. That is something CMS is looking into, and we'll be able to respond to that hopefully here in the next week or so about how we're going to be able to do that in the Netsmart EVV application. Next question is, hi, I seem to make a lot of corrections for missing check-in and check-out. What are the requirements for compliance to regards to errors manually corrected? So we don't really release what our quality assurance requirements are behind the scenes, because that's part of our monitoring that CMS wants us to do, and they certainly don't want it available to everyone. So I've gotten this question quite a bit about, well, I want to know what your rules are behind the scenes to make sure that I'm staying in compliance. All you need to worry about is you're not committing fraud, waste, or abuse. That's all you need to worry about. And we will never, as an agency, penalize somebody for administrative errors, forgetting to clock in and clock out. We will never, go after somebody in either our auditing process or our hearing process for simple clerical issues. That's not what the department does. That's not what the department has done since I've worked around the department, which has been a very, very long time. This system is designed to catch fraud. So if you are missing clock-ins and clock-outs, you need to work with your staff, first of all, to make sure that they understand the importance and that they're doing clock-in and clock-out. I've told this story a bunch of times, but when I worked at a record store, I eventually got written up when I was a kid because I would forget to clock in virtually every day. I would just get in, start talking to people, start working, and I would forget to clock in, and they would have to go back and adjust my timesheet. As an employer, you're going to want to do the same thing. If you have an employee who just can't do some aspect, like they couldn't do documentation or they weren't showing up for work, you're going to want to address that with the employee. We also totally get that in the beginning, there will be a lot more errors than a year from now. We totally get that. I have communicated to virtually every state and Guam about the use of their EVV system. So I know what the pattern is about the usage of system and how the system gets better as you go through times. So please don't think we're not taking that into account and that there will be errors in the beginning. And again, I want to assure you, for clerical errors, nobody here is going to get in trouble for that. The purpose of this is to catch fraud. Again, another question, the next question is about the comp program, which I've already addressed. Brittany was good enough to put in the Lifeline number. Thank you. There's a request for an enhancement to the system so that clients can upload the care plan. We will certainly take that into consideration. The last question is, we have a couple of clients who don't have internet service. And if they want to opt for IVR, they don't have a landline either. So let me say this. This is a mandatory condition, and there are no exceptions to the rule. So if you do have in the 2021, you have members out there that there is absolutely no way that they can get contacted. I have a lot of questions about that. Like, what happens if there's a fire at their house? Is it a safe living condition? There's no way to call 911 or get in contact with anyone from the outside world, right? I'm not sure that's a safe living condition for our aides to be going into and the members to be receiving services at all, which isn't a condition of participation, by the way, that it be a safe place for somebody to go. So if you have those instances, The Georgia Lifeline phones are something that the members could utilize. If you're saying there's no cell coverage, no internet coverage, no landlines, and the workers also don't have phones and they can't clock in and clock out, you need to let us know that. We're going to send out investigators to look into the situation. That's what we're going to do. We're going to send my staff out to actually look into the situation so we can respond to CMS about what needs to be done in that situation. So please spend the specifics in that situation to the EVV mailbox so I can have my folks go out and really do some investigating for that. Last question. Yeah, so the last question is this being recorded? And all of our presentations are always recorded. We try and make everything completely open and available so that if you're late, you can go back and listen to them at any other time. So I super encourage you to go back and not only listen to the beginning of this one, but maybe listen to some of the older ones. You can even fast forward to the Q&A sessions like this, and it is very, very helpful. I did get a private message about responsiveness of the call center, and I don't want to get too far into it, but if you are having responsive issues with the call center, please go ahead and send that to the EVV mailbox, because it's our responsibility at DCH to follow up with that with our contractor, who is Conduit and then Netsmart, of course. Okay, 1 second. The only other question is, is about pay rates. So I say this frequently to folks, the Department of Community Health works with the legislature and other to ensure pay rates. Yeah, we understand there's a workforce shortage. We hear it across every single provider we have. Guys, and it's not just you guys. It's not just healthcare. My car broke down Sunday. Do you know it took 3 days to get it back for something that was pretty fairly simple? And the first thing that the car dealership people said to me is, we can't find people to work. We cannot find mechanics. They were offering $26 an hour as a start for like techs to do mechanic work. And they were also giving all these bonuses, because I was like, maybe I could be a tech. It doesn't seem like something I couldn't learn how to do. So it's not just you guys. It appears to be across lots and lots of services. We have certainly heard that concern, and we are working with the federal government and our legislature. Of course, we don't have any money. We don't do bake sales. We don't do car washes, right? So our money comes from tax dollars. It's all tax money. So we have to have that tax money allocated to us before we can do any provider rate increases. Okay, that completes all of our questions for today. I again want to thank everybody for joining us. Your continued participation is so very, very important. Your questions and comments are also one of the most important things that we have in our toolkit for the implementation of EVV. So sincerely, thank you for joining us today and continuing to be so engaged in this federal mandate. Thank you, and I hope you have a wonderful rest of your week.